Good morning, good afternoon, good evening to all the participants from around the world. My name is Muralee Thummarukudyil. I am the Operations Manager for the Crisis Management Branch of United Nations Environment Program in Geneva. Today, we are organizing this webinar on waste management during COVID-19, from crisis to opportunity. Some of you may know that since start of this COVID pandemic, UNEP have been in the forefront, providing guidance on issues related to waste management. We already did our first webinar in July, where we had more than 1,000 participants. We had a second webinar in September for Asia Pacific, which also had more than 500 participants. This is our final and concluding webinar, where we have over 800 registrations from more than 100 countries. So I welcome you all to this webinar. We are standing at a very critical point in this COVID pandemic trajectory. As you know, COVID started around this time last year in China. And within 4 months, by April 2020, all the 120 member states of United Nations was impacted by COVID. The virus had reached those countries. But it was not just a health crisis. It also caused lockdown of those economies. And it then led to massive economic crisis, then an employment crisis, and then a crisis in education. So it is a multi-sectoral crisis. It is within this context that we were looking at the linkages between COVID and environment. The most obvious of this is the healthcare waste. When you have more than 70 million people impacted by COVID as of now, clearly hospitals have been overwhelmed, and for every patient who is admitted to the hospital per day, you probably have anything from 1 to 3 kilograms of healthcare waste produced. Some countries had the systems, and the systems were overwhelmed. Some countries did not have the systems, and that caused additional trouble. But it was not just about waste management. It also created other challenges in terms of people who were recycling the waste, people who were in the rag picking business. They were affected as well. Often, these people were at the most underprivileged of the society. In some countries, they were migrants, often women, children. They were already ostracized by the society in many countries and many societies. And COVID added an extra layer to that. So their livelihood was disrupted, their profession was ostracized. They had this range of challenges. UNEP, starting already in April 2020, came out with a series of fact sheets and recommendations as to how to handle this situation. I already mentioned about the webinar we did in July. But starting last September, we have been working with the Swedish government to provide real-time technical assistance to member states who wanted assistance on how to deal with waste management as well as other environmental issues arising out of COVID. Our experts, whom I'll be presenting to you shortly, assisted countries like Haiti, Sudan, South Sudan, India, and Afghanistan. I was myself involved in supporting a number of countries. South Africa, for example, countries in Central America, on undertaking detailed assessment of what COVID is doing to those economies, including the environmental sector. COVID exposed many vulnerabilities of our society, not just in health management. We also found that lot was missing in environmental infrastructure, and that is why we called it from crisis to opportunity. We are standing at a point where, as the Director General of WHO said, we have a vaccine, and at least it is possible now to dream about a day when COVID is not the top priority in our life. Of course, we are now facing a second wave in Europe, a second strain in UK. But I'm confident that scientists and policymakers and healthcare workers would help us to tide over this crisis. But then there are lessons which we have learned. Everyone has learned lessons. Healthcare workers have learned, teachers have learned, so have we. So I'm extremely delighted to present to you today 5 experts who assisted United Nations on behalf of the Swedish Contingency Agency, MSB. And they will talk to you today about their experience, and I will give their details. The experts today are Annika Sällvik, who is an agricultural engineer with a variety of working experience. Her focus in the last 20 years has been on systematic environmental issues and environmental management system. Annika, welcome to the session. We have Ida Eriksson, who has 14 years of broad experience from the environmental field, such as soil pollution, health protection, waste management, wastewater treatment, and water conservation. Ida also has experience from working in humanitarian projects and municipal crisis management. Ida, welcome. We have Magnus Lindsjö. Magnus has 15 years of experience on finding solutions on waste management in both day-to-day and crisis situations. Although striving towards a reduced amount of waste and recycling, Magnus has substantial experience of sustainable and safe handling of waste. Magnus, welcome. We have Britta Palm. Britta has more than 10 years experience of broad environmental work. Her main focus is on contaminated soils and waters. She holds a master's degree in soil science from the Swedish University of Agricultural Sciences and has experience from humanitarian and environmental projects worldwide. Welcome, Britta. And finally, we have Anja Christina Beer. Anja is a trained political scientist with focus on environmental integration in all processes of decision making. With experience from many countries and contexts, she has been working with environmental integration in international development cooperation and humanitarian support for more than 20 years. So you have an extremely distinguished panel before you. Please have a good session. Please keep your questions coming, and you will have about 30 minutes for question answer session. Annika, you have the floor.
Thank you, and good morning, good afternoon, good evening to everybody listening. And again, thank you for giving us this opportunity to talk about some of our findings and thoughts from this pilot project. Next picture, please. As Muralee just mentioned, this project started earlier, and in the middle of July, in the middle of the Swedish holiday season, there was sent a request to MSB and it was taken care of by Elena, who has also been taking care of us. We were 6 consultants working with MSB. The request was in 2 ways, one about rapid environmental assessment, and one was about waste management. We have been working together on this, but we have been working mostly in different countries. As in many projects, it was postponed a bit due to the explosion of Beirut. So we had the first start-up meeting in September. And after meeting Marguerite and Muralee, we were divided into the countries where we have been focusing: Afghanistan, Haiti, India, South Sudan, and Sudan. After the first meetings, we have been working with the different countries. We have been working remotely and on different digital platforms. And we will now, together with my colleagues, give you some examples of our findings in each country. So please, next speaker and next picture.
Thank you, Muralee, and thank you, Annika, for this excellent introduction. I will emphasize some of in the introduction that Muralee was giving. And I will start by saying that what many scientists have already said, that the research shows that the ecological crisis is one of the root causes of the COVID-19 pandemic, as well as previous and coming zoonotic outbreaks will be. The relationship between environment and disasters such as COVID-19 has received significant attention already, and today we do know that the emergence of zoonotic pathogens is strongly linked to environmental degradation and human interaction with animals in the food system. More than 50% of zoonotic infectious diseases that have emerged since 1940 have been associated with measures to intensify agriculture, deforestation and land use change, including the conversion of natural ecosystems for agriculture or urban development, have also been found to impact species diversity and abundance, favoring animal species that act as reservoirs for zoonotic disease. Although one planet, COVID-19 does not affect everyone in the same way. There are several reasons why different socioeconomic groups are affected by this pandemic in different ways. To understand the consequences and to predict how this pandemic affects differently with various socioeconomic groups, access to good data is key. However, that has been not very easy for us. To find accurate data for these cases that we are used in this assignment, these countries has been a challenge for us all. So we can agree on the fact that COVID-19 shows that the existence and health of people and the planet are one and the same, and that we do all have to care. Next, please. So looking a bit closer to the different environmental aspects, we have to acknowledge that human pressure on diversity in all aspects have created preconditions for the emergence of the pandemic and set the stage for its drastic effects. The depletion of chemical, biological, and human diversity has resulted in an accumulation of destructive actions impacting humans' activities and global governance strategies, as well as the entire species and ecosystems. The immediate impacts of the pandemic on the diversity of the anthroposphere due to large-scale guarantee regimes during the first half of 2020 may appear positive in the short term, but we do already know they have a negative consequences in the long term, if not monitored wisely. The nature degradation is a fact with the disruption of pristine forests driven by logging, mining, rapid urbanization, and population growth is bringing people into closer contact with animal species they may never have been before. And the increase virus spillover from the animals to humans can be linked to biodiversity loss and environmental degradation, as I already mentioned. And these events have been tripling every decade since the 1980s. And for now, it's a hidden cost of human economic development. One of the most evident short-term effects of COVID-19 lockdowns was the dramatic improvement in air quality, and especially in some of the world's most polluted cities. This period gave a glimpse of some of the benefits that could be achieved from a lasting and sustainable reduction in air pollution. And short-term reductions in air pollution, greenhouse gas emissions resulting from lockdowns will themselves have minor long-term effects unless they facilitate deeper and longer-term human business and institutional changes. As it is now, the coronavirus pandemic has been accompanied by an increase in chemical exposures due to more frequent and widespread use of disinfectants and hand sanitizers and cleaning products and personal protection equipment, so-called PPEs, as well as uncontrolled application of other measures such as non-prescribed medication. And as Muralee also mentioned in his opening remarks, the hospitals and many waste that has become more of this is devastating. The supply of clean drinking water and treatment of wastewater are critical services which continue, not least because of COVID-19. Our repeated information to wash our hands frequently to fight the virus is not possible for all to fulfill, especially not in those countries that we have been involved in during this assignment. Ensuring that quality standards are met for drinking water and discharge wastewater is anyhow a key priority for all countries, though. And then climate change is above all this, as one of the pictures is indicating. Next, please. So besides the situation regarding degradation or pollution to all natural resources that is our foundation for life, COVID-19 is creating an unprecedented challenge to waste management across the globe. As the number of patients needing hospital-based healthcare exploded in the beginning of this year, breaching the capacity even of developed economies, it caused similar challenges in waste management infrastructure too. And as pointed out in the slide, without urgent action, global waste will increase by 70% on current levels by 2050. At least 33% of global waste is not managed in an environmentally safe manner. And the world generates 0.74 kilogram of waste per capita per day, and to note, not equally distributed, as the Western world is has much higher consumption patterns. The pandemic has also affected non-healthcare waste management too. Efforts to control and minimize plastic received a vast setback, and many countries had to relax to the regulations on plastic only to meet the immediate demand for increased home deliveries and food provisions, and that goes for all countries. Waste recycling in the informal sector came almost to a halt due to fears and concern about infection, and of course the previous and ongoing lockdown has and is inducing mobility restrictions and economic downturn. So, however, there are many good issues as well to take into considerations. As the graph on the right-hand side shows, there is a high percentage of all waste that is to consider as general waste and not as toxic or infectious waste. It is a universal graph, and as we will hear later in the presentation, has also proven correct on country level. Therefore, an effective management of biomedical and healthcare waste requires appropriate identification, collection, separation, storage, transportation, treatment, and disposal, as well as important associated aspects, including disinfection, personal protection, and training, of course. So COVID-19 waste should not be treated differently than other infectious waste. However, it is important to distinguish between infectious waste and waste which is not. Next, please. So as can be seen, by recognizing the waste and distinguishing the type of waste, there is much we can do about it. We have an option to focus on the opportunity to reduce They shall remind us of the importance of reducing our waste production on a daily basis and thus avoiding our contribution to the piles of materials on land sites. If we take care of things, it is possible to use them longer and also for different purpose. We should reuse goods as much as possible to give them a longer life. If the recycling bin is less full, automatically the environmental impact is reduced because the recycling process is not done without an impact on the environment. Sorting, cleaning, melting and transforming recyclables in new products use a lot of energy as well. After having induced, reused and recycled, it is important to recover. Recovering means to transform waste into resources. And for all this, we, people and the social system, has the tools necessary to manage, such as, for example, good governance and legal frameworks. And in this matters, it is possible to support those countries less fortunate to have legal frameworks being enforced. Next, please. As already mentioned, in short term, there have positive signs already been seen. However, that is nothing that will last if the world does not take the opportunity to act in such a way to limit and to decrease outbreaks like COVID-19 in the future. The positive signs also to managing long term are here already. From the biodiversity perspective, for example, China's action to ban the consumption, farming and sale of wild animals looks as though it could become permanent, then there could be huge benefits for wildlife. There may also be other benefits for biodiversity, such as increased breeding of species sensitive to human activity, less illegal hunting, greatly reduced pressure on fish species. And these kind of actions make various experts and issues not stand alone. They are interconnected. So research and an integrated approach is key to know what steps to take to protect our planet and the impact humans have. Policy making and decision planning are important tools that we should use wisely to push for positive impact and solutions and not exploit natural resources in a devastating manner. The global cooperation is important to understand how we humans impact the planet with different activities. But we also have the opportunity to find local solutions adapted to context. For decades, global solution has been the answer, and however, the context is important, and many times a local solution to a challenge will provide a long-lasting solution. So while there is a clear need to focus on immediate humanitarian response, governments cannot lose sight of environmental sustainability. Next, please. South Sudan was one of the countries included as a case study and should be mentioned as an example for opportunities here. South Sudan is a country with most severe and immense constraints for its people. Though COVID-19 is not to be seen as a minor threat, on the contrary, however, South Sudan does have not one but several crises ongoing that will kill the people before COVID-19 will. So violence has soared the country for too long time, and now famine is threatening parts of the country due to severe floods since months back. South Sudanese in their neighboring countries, as well as forced from their home for various reasons, and also internally displaced. There's a fragile peace and the lack of institutional capacity and legal framework, as well as infrastructure. So at the same time, the country does have an opportunity to revitalize the protection of the country's environment, and COVID-19, as well as other disasters that the country stands in front of. Rightly recognized in its national anthem, it is said to be the land of great abundance, being composed by teachers and students from Juvad University, coming from the people themselves. There are several positive issues, as you can see in the slide. There are some listed. And having said that, we also could and should conclude that we have never been faced a crisis this big, but we also never had a better opportunity to solve it, actually. Oh, thank you. And the next speaker.
Yes, hi. Ida Eriksson here. My task was for UNEP Sudan to create a rapid environment assessment about how COVID-19 affects the environment in Sudan, not limited to waste. I was also asked to recommend mitigation activities and to moderate a Sudan-specific webinar, probably in January, about waste. I had 3 focal points at UNEP Sudan that were very helpful, so I would like to say a big thank you to Muna Sain, Attila Uras and Robert Paul Becker for helping me. And Sudan is heavily affected by the COVID-19 outbreak, and a second wave seems to be happening right now, unfortunately. And today we see more than 23,000 confirmed cases and 1,400 deaths. And these numbers are believed to be largely underrated due to a lack of testing capacity. So the problem is even worse. Next slide, please. And my main difficulty was, as Anja mentioned, to find current and specific data on the situation regarding COVID-19 today in Sudan, and to get enough background information to make specific recommendations. This is in no way specific for Sudan. The challenge with information in an emergency situation is always a factor to deal with. And my report and my recommendations are, because of that, maybe more general than what I would like to prefer. But I had some sources of information that helped me a lot in my work. Sudan just published a report called State of the Environment and Outlook with a lot of current data, and a newly published book, Integrated Risk of Pandemic by Goyal and Gupta. And the UNEP fact sheets were also a big help with my recommendations. And links to these sources will be provided in the chat and also in the end of our webinar. Next picture, please. The situation in Sudan is similar to the one in South Sudan that Anja just described, with unrest and many environmental challenges. I cluster them into 6, sorry, the light goes off sometimes here. I cluster them into 6 main environmental challenges: soil degradation, deforestation, pollution, water scarcity, climate change, and natural disasters. And I did assessments on all these challenges regarding COVID-19. And desertification and deforestation is worsened by careless land use, harvesting of biomass for fuel, and not sufficient management of nature and land. Movement of people, such as refugees and IDPs, is a major factor in land degradation. With COVID-19, it is very difficult to supervise land use and maintain the management needed. And natural disasters burden Sudan frequently. There are severe floods right now in most states, and many people lost their homes. Crowded camps for the affected is a risk of infection, and constant wet environments are grounds for other infectious diseases, and a deteriorated health increases the risk of getting COVID-19. Regarding climate change, there is not really a net negative effect from COVID-19, surprisingly enough. Less traffic causes less carbon dioxide in the air, but there is a risk that lower oil prices due to less transports make people abolish plans for renewable energy and get diesel generators instead. Water scarcity in Sudan will be worsened by the pandemic and the increased need for water for sanitation and hygiene, for hospitals and for laundry. Pollution is the challenge that we are addressing mostly here in this webinar. Plastic waste from personal protection equipment and packages and medical waste is increasing a lot, and more pollution from waste is already a reality. Next slide, please. I have no current data on how much more waste COVID-19 generates in Sudan. But if we look at Wuhan in China, the amount of municipal solid waste increased by 300%, and the amount of healthcare waste increased by 600%. And that would push municipal solid waste in Sudan from 7.7 million tons up to 23 million tons this year. The amount of healthcare waste will increase from 1.1 million tons up to 6.5 million tons this year only for the Khartoum state. There is no capacity for these amounts. The impact from increased waste is land degradation, contamination of soil and groundwater, and particles and air pollution from combustion of waste. The short-term challenges are leakages of toxins from landfills and waste dumping, health hazards due to handling of possibly contaminated waste from hospitals or infected households, and possibly contamination by improperly treated wastewater, which I will get back to in the next slide, and capacity in handling medical and infectious waste. The long-term challenges are health degradation due to pollution effects, food scarcity due to land degradation and pollution of fertile soil, water scarcity due to pollution of water by waste and wastewater, and overall waste management capacity. Government capacity and proper legislation and supervision of waste management is also a big challenge. This, of course, has cumulative impacts on all the environmental aspects that I mentioned before. Next slide, please. And I promised you that I would look quickly specifically at wastewater, which is a favorite subject of mine. Municipal wastewater has been found in research to contain possibly infectious COVID-19 virus cells. There is no confirmation yet of infection by a human from wastewater, and the virus is believed to disintegrate quickly in water. But we have seen infections through wastewater for other similar virus diseases, so we have to take caution and treat wastewater as a possible infection source for now. Next slide, please. And this is a selection of recommendations from my report. Solid waste needs reduction, as Anja mentioned, to allow space in the management systems for possibly contaminated waste. About 2/3 of the solid waste generated in Sudan was collected before the pandemic. Reduction can be achieved by reuse and recovery of materials, and there is a good potential for composting of food waste and to produce LPG or soil fertilizer as a byproduct. And we need to find use for more of the materials in the waste chain. The disposal of possibly contaminated waste needs to be improved. Landfills and collection facilities need to increase their capacity and efficiency, and the risk of infection of staff must be minimized to keep them at work. Stakeholders in the waste production system and management system should be identified, and their needs and conditions need to be closely assessed to make sure the right actions are taken. Important stakeholders are waste pickers, as Muralee mentioned, and healthcare workers. All hospitals and healthcare centers need to have access to a functioning incinerator or steamer. And reaching out to the public about proper waste management is very important to raise awareness. And local small-scale wastewater treatment plants can improve the overall wastewater management systems in densely populated areas and for hospitals. Properly treated wastewater is also a good source of water for irrigation, but the risks of virus in the water needs to be controlled first. Landfills and waste stations need to be neatly managed to prevent plastic waste and wastewater leaks from the plants. And freshwater access, of course, is crucial for sanitation and proper hygiene in a pandemic. This is a challenge, especially in crowded rural camps for IDPs and refugees and flood refugees right now. Next picture, please. And I noted some possibilities that could develop waste management in Sudan. Knowing where the weakest links in the waste management systems are is a good starting point for planning new actions and activities with relief fundings and international cooperations. It is also good to look at the few positive environmental effects of the pandemic and try to keep some good practices. For example, Sudan might benefit from keeping more of the crops in the country and have less of the crops exported to other countries. And air quality and noise in cities have improved. And looking out for the healthcare staff and the work environment might attract more people to work in healthcare. Also, keeping staff healthy is keeping them at work. A possibility with increasing waste management and recycling of materials is to try to make waste pickers a part of the official economy. Job losses and livelihood losses is a sad reality in a pandemic with lockdown, so a push towards creating more official jobs will benefit Sudan in many ways. Over to you, Magnus.
Okay, thank you very much. My name is Magnus Lindsjö. I'm an environmental engineer working mainly with waste management, landfills and contaminated areas in Sweden. I thank you all for listening to us, and I thank you at the UNEP for giving us this space, this opportunity to show our results. Through MSB, OCHA and UNEP, I have had the possibility to work with the UN colleagues in Haiti, both on matters concerning COVID and other environmental issues as well. Today I will talk briefly about the risks of infectious disease spreading through the waste management system and how this needs to be addressed for future epidemics before they break out. I will have the developing countries in focus, but the baseline is universal for all countries. During the ongoing COVID outbreak, WHO has confirmed that there has not proven to be any considerable spread of COVID virus through the waste management. As we will see, the most exposed population is, however, not included in the best of health care and is probably not tested in the same extent as other groups of our society. Slide, please. Thanks. I would say that people in general have a good understanding of how a virus spread from person to person, but not always do we have the same understanding of the spread of a virus through the waste we produce. Looking at Haiti, about 20% of the population within a survey stated that they had received no information and had no understanding of this type of virus spread through the waste. The remaining 80% who got this knowledge still answered that they mainly disposed of their waste in the nature into the waters. So perhaps it didn't have that big of affection. Slide, please. Even though it is not always appreciated, we also have the means to reduce the spread of a virus from person to person during an ongoing epidemic. This can be through lockdowns, personal protection equipment, etc. But as we heard before as well, we cannot stop the production of infectious waste. On the contrary, it's a growing amount during an epidemic. And it's very much more difficult to create a secure management of this kind of waste during a crisis than before, especially the waste that is produced in the homes. Slide, please. And the further this infectious waste is transported along its line of transportation and management, the more people and the more unprotected people is exposed to it. The vulnerable group at the end, the waste pickers at the landfill, is sparsely included in healthcare systems. They will probably not be tested for infections, and they do not have the possibility to quarantine themselves. An outbreak of virus infection within this group would probably be difficult to stop, and would also turn this into a socio-economic question, like Muralee stated in the opening remarks. As noted before, this has not been the case during the COVID pandemic, but this is not the last epidemic we will see, and we need to build this back better. Slide, please. So if we look at the ideal waste management like we had before, the hazardous infectious waste is separated from other waste at the health facility. The hazardous waste is treated in some way, probably some kind of high temperature incineration, at least in the developing countries, and preferably on the grounds of the healthcare center facility, while regular waste is recycled or landfilled. Slide, please. But during a humanitarian crisis, it's more often that we cannot rely on the incineration of hazardous waste. The furnace may be out of fuel, it might be damaged, it might be overwhelmed with waste, or most often, it might never have been installed in the first place. The lack of destruction possibilities during an epidemic will lead to that infectious waste is mixed with the regular waste and brought to the landfill. Or that infectious waste is piled up, posing a risk at the healthcare facilities. It's not only in the healthcare facilities that infectious waste is created. During a pandemic like this, it also occurs when sick people are treated in homes, where there usually is no organized handling of infectious waste and no knowledge of how to do so. Hazardous infectious waste gets mixed with regular waste and is sent to the recycling or more often the landfill. Slide, please. At the landfill, exposure to infection may cause uncontrolled outbreaks among people depending on picking waste. It may also affect the waste transportation system, causing waste to pile up in the society in turn causing severe problems, not only related to the virus infections. Slide, please. At the landfill, we can also stumble upon an infectious spread or mutations that are not expected. Once again, this has not been proven to be the case during the ongoing pandemic, but it might be in the future, and we need to take care of that. The opportunity for the future will be to create waste management systems with a solid, sustainable mechanism for handling of infectious waste. Waste that is oriented both in healthcare facilities and in homes. And of course, we strive towards a better use of the waste than just landfill. Slide, please. In order to have this planned and implemented, there is need of funding and work capacity. During peaceful times, when there is a good potential of work capacity and space to work with improvements and sustainable matters, there is often a lack of funding, which makes the work very difficult. During a crisis situation, funding may be abundant, which is very good and necessary for the humanitarian response, but people who can work with these matters are choked by attending the crisis and have very limited possibilities to implement strategies and technologies for sustainability. The background to this slide is my own personal experience from working in Haiti in 2010 in the humanitarian crisis in the aftermath of the earthquake, and then returning to Haiti 10 years later and finding quite the same experience, but the opposite side of it. Now there is no funding, but there is good work capacity. Slide, please. And in order to achieve sustainability and capacity building, we need to have sufficient funding and good work capacity at the same time. Then there is the opportunity to prevent further future humanitarian catastrophes and reduce the amount of money needed to be spent on disaster response. Once again, looking at Haiti, there is a tremendous need of sustainable waste management. As a result of the pandemic, there is also an awareness of the waste situation. The survey I mentioned earlier noted that waste management is the #1 environmental concern of both the common people and the mayor's office, and they find that very significant. So the timing and the mindset is perfect to work with the with sustainable solutions for waste management in Haiti right now, but there is the lack of funding. Slide, please. So to summarize, I would call for awareness. It is difficult to control our waste-related spread of contagious infectious disease during a large-scale ongoing epidemic. Safe and environmentally friendly destruction of hazardous waste is much needed for many reasons. While strategy is outlined and destruction methods implemented, the aim must be to take care of all the waste during all circumstances, not only the hospital waste during daily routines. To the right is a compendium on treatment on healthcare waste. I want to share that with you, and the link will come at the end of the presentation. Thank you very much for your time, and I pass on to Britta.
Yes, hello everyone. I'm glad to be here with you today. My name is Britta Palm, and I'm here today because in July, as Annika said, I got the opportunity to work as a remote environmental advisor through MSB and UNEP. My task is to contribute with a report on environmental impacts due to the COVID-19 outbreak in Afghanistan, and also to take part in this webinar. I will also want to take the opportunity to say thank you to some of the UNEP staff in Afghanistan, Saida Gwari, Mohammed Husnain, and Mohammed Kamal Bawar for the contribution of information and photos, and to Michael Cohen for his help. Yes, and here we have Afghanistan in the central or southwest of Asia. The population is approximately 38 million. The country is currently recovering from nearly 4 decades of conflict, which has damaged much of the country's infrastructure and weakened its institutions. Afghanistan is though catching up with other low-income countries concerning access to health, education, and infrastructure, although there is a widespread poverty. Insurgent activity and military operations have affected food security in some regions, and today around 11 million people live with severe food insecurity, and the situation has gotten worse due to the COVID-19 outbreak. Yes, and with that in mind, it's easy to understand that environmental problems have not been a priority area. The country is facing many environmental challenges like degradation of natural resources, pollutions, and climate change, and now also the COVID-19 pandemic. The outbreak of COVID-19 hit Afghanistan in a sensible time in the middle of a peace process, and unfortunately has the number of violent incidents increased during the pandemic. And now I'm going to talk about one of the challenges that Afghanistan faces, and it's the waste management. Next, please. Management of waste is one of the key challenges during normal times in Afghanistan. Population growth, together with better living conditions, has led to a bigger generation of waste. During emergency like the COVID-19 pandemic, these challenges are magnified. This is what the collector point for domestic waste looked like before the COVID-19 outbreak in the city of Mazar-i-Sharif. The capacity for the waste collection is small compared to what is generated. Study shows, for example, that only between 12 and 25% of the generated solid waste per day in Kabul is collected and transported to the landfill. Next, please. The waste that is not collected by the municipality or waste pickers ends up dumped in open spaces, on access roads, and along watercourses. Solid waste is usually also one of the main reasons to local flooding because it blocks local waterways and drainage channels. The waste, and especially the plastic, can also lead to animal suffering when they consume it, like in the photo next here. Next, please. And here are some challenges with the municipal solid waste due to the COVID-19 listed. There's an increased amount of waste, especially plastic. During the pandemic, there's a drastic change in the nature of waste generated. Single-use plastic, personal protective equipment, but also medical and chemicals used to reduce the risk of COVID has increased a lot. There is also insufficient capacity of waste collection due to the big amounts generated, and this was already a problem before. There is limited collection and recycling of waste due to the lockdowns. There is no waste separation. There is a mixing of infectious waste from, for example, people in home quarantine and general waste, and that can increase the risk for transmission of the virus. There's an increase of littering, dumping, and open burning of waste due to the bigger amount of waste. Next, please. In the cities, the municipal waste from the collector points is transported and left at dump site or landfills, as for example this one. The existing dump site or landfills are often located close to major communities without taking into account the environment or the risk for human health. A study shows that it would require 41% of the current Kabul municipality budget if the waste was all adequately collected and disposed. Due to the cost, it is necessary to reduce the amount of waste as well. Alternatives like recycling, compost, household field should be considered. Next, please. Then we have the healthcare waste. Most people think of this kind of waste you see on the picture when you talk about healthcare waste. There are sirens, bandage, PPE, body parts, but actually it's the composition of the healthcare waste like this. Next, please. The pie chart shows the composition of healthcare waste in Afghanistan, and it is very similar to the data that Anja showed us in the beginning. 82% of the waste is general waste. That include non-hazard waste like paper, packaging, food waste, etc. And the rest, 18%, is infectious hazard waste like sharp, syringe, used bandage, blood products, etc. There are around 40,200 healthcare facilities in the country. All the healthcare facilities generate together approximately 150 tons healthcare waste per day during normal condition, and this actually is quite low compared to other countries. Next, please. This diagram shows a comparison between the generation of healthcare waste before the pandemic outbreak and the situation today. An estimation was done where the generated waste per day was set to 1.8 kilo per hospital bed in day. As shown in the diagram, has the amount of hazard healthcare waste increased from 27 tons per day to 115 tons per day. And that's an increase in more than 300%. A few months after the COVID outbreak, did UNEP and the National Environmental Protection Agency in Afghanistan a survey with the aim to understand the existing condition regarding the waste management. There were in total 40 responders among regulatory organizations, waste generators, and waste management companies in 12 provinces. Due to the difficult situation with limitation and lockdowns, the answer rate was poor, only 40, and some of the answers are not considered as realistic, but I will say something about it anyway. Next, please. The survey showed that half of the respondents from the healthcare facilities said that the COVID-19 waste is separated at source using separate bins like in the first picture. But more important, 28% of the respondents do not consider COVID-19 waste as infectious, which means that no control measures are applied at all. So my conclusion is that most of the healthcare facility mix the waste without any separation, and that causes that all waste should be classified as hazard and infectious waste. Next, please. And here are different waste storage at hospital areas in Kabul, and all waste seem to be mixed. Although in one of them is the color-coded plastic bag used, but unfortunately the waste is mixed with the general waste anyway. Next, please. The mixing of the healthcare waste may occur in the dump site landfills during the transport, or maybe already in the hospitals, or even worse, that the healthcare waste is mixed together with the domestic waste from the street, as you can see in this picture. Due to the healthcare waste in the street, waste pickers can be exposed to sirens and other infected material from the hospitals. Next, please. The biggest part of the healthcare waste ends up in dump sites or landfills and is usually mixed with other kinds of waste. The majority of the healthcare waste from hospitals in the cities are managed by private companies that transport the waste. Although the municipality of Kabul has earmarked an area for healthcare waste in the landfill of the city, the waste seems to be mixed or even burnt anyway, as shown in the picture. Next, please. Due to the survey conducted by UNEP and MSB, more than 1/3 of the responders mentioned that infectious waste, COVID waste, is treated in the facility with their organization. Among the treatment was waste burial, followed by open burning, the most common methods. The ash pile behind this man indicates that there is an incinerator at the hospital, or that open burning of waste takes place in this hospital. Next, please. The survey showed also that very few hospitals have their own incinerator. Here are different types of incinerator methods that have been observed in Kabul. There are from very simple ones to more advanced. Next, please. And here are some challenges with the healthcare waste in Afghanistan due to the COVID-19 listed. There is an increased amount of healthcare waste, especially hazard and infected waste. There is insufficient knowledge and capacity of safe handling, separation, storage, and transport of the waste. There is limited collection of healthcare waste due to lockdowns. There is an increase of improper treatment in place due to the increase of waste. And that treatment is like bad storing, open burning, uncontrolled dumping, that it will increase. Next. So how has the Afghan government responded to the pandemic according to the waste management? The Ministry of Public Health is the leading agency for coordinating the COVID-19 response. This includes also the healthcare waste management. Afghanistan has been active in developing guidelines for the waste management and also different response plans to fight COVID-19. As shown in the slide, Afghanistan has, for example, a COVID waste management guide where practices for COVID-19 healthcare waste concerning separation, storage, and transportation has been clarified in the guide. There are regulations, but the problem seems to be that it's not followed. Next, and this will be my last slide. Here are some final short suggestions for improvements. There's a need of capacity building and awareness raising among the healthcare facility workers and the public concerning waste. For example, the importance of safe handling of infectious waste, environmental and health consequences of illegal dumping, open burning, risk of infection. There is also a need to reduce the amount of waste that is collected and transported to the disposal site due to the big cost for the municipalities. To reduce the cost for the municipalities, can capacity building of separation, recycling, compost, and also introduction of a collection fee be different methods. There is stronger regulation and associated enforcement practices concerning the waste. For example, there is a need of monitoring to prevent that healthcare waste is not left in the street by hospital. As was shown in the table in the slide before, that there is regulation in Afghanistan concerning the waste, but the problem is to follow it. And appropriate treatment and disposal methods. The UNEP fact sheet can be used, and also the set guides to get the best management of waste in a country where technology, environment, sociocultural, and economic situation is considered. We are in an emergency situation now, but we also have to consider how we can get a more sustainable way of handling the waste in Afghanistan in the future. Thank you. I give the word to Annika.
Thank you. Next slide, please. As you have heard my colleagues talking about some examples from the work we have been doing, we want to emphasize need, which we have used a lot, the useful links that is on this slide, because as you've heard, a lot of the issues are the same, and not having to find out all the details from the beginning to have these general facts is very important. Then from the general fact, trying to find specific fact about each country and the context, that's difficult. But without these useful links, we would not have gone as far as we have. Next slide, please. Talking about this, as you have heard, this is the beginning, not the end, unfortunately, of COVID, but we will still need to be work on the environmental issues, the climate change issues. COVID-19 has only emphasized a lot of this during this work. During this session, you have heard some examples that are specific to the countries. We could have been working in probably other countries and found more or less the same things. So it's very important that we continue work together, because every person that has the ability to be working environmentally friendly, climate friendly, and share the knowledge, we need to do that. This pilot has been a pilot with all of us working remotely. And as in all projects, and especially pilot projects, there are some findings. General findings like it always takes time. It always takes a lot longer time if it's not an emergency. As I talked in the beginning, the startup was postponed. We have also had, due to the COVID-19, we have had sick people, both from us working remotely, but also in the point of contact persons abroad. And this is one of the difficulties, is when you're not in the context where you're supposed to be working, it's hard to know who should be the one I should be asking when I cannot find my point of contact. But even though we have been able to meet people on digital media, and I think this is a very good way of working. If there is a possibility, and I should also say that even if it was postponed, we have been able to longer the project, so we will be able to continue working. We've been working December, and we will be working some more. And if we had a chance, we would like all of us to say yes, we would continue working this way. Even if it's nice, it would have been nicer to meet the people we're working with and to really see the context when we're working in. This is a way to work in addition as to ordinary work. Next picture, please. And we would really say thank you to Muralee, to Marguerite, to the people we have been in contact with, but also to the people behind the scenes who helped us set up this webinar, because we could not have done it ourselves. And as said before, we need to be working together for a better environment, for a better climate. Thank you.
Thank you, Annika, for concluding this session from your end. The pleasure of working with 5 professional experts from Sweden is that we started on time and ended perfectly on time, which leaves us with plenty of time for question and answers. So we will have about 25 minutes for questions and answers. One of the first questions we had was about remote working, which in a way you have already answered. What were the challenges? And like you, I also hope that we will all have an opportunity to meet together. So maybe when things are over, we can have a get-together of the country focal points as well as the experts and have a lessons learned event. As you mentioned, a number of counterparts in our country offices has been supporting you. Maybe many of them are listening. So if you are listening from India, Haiti, Sudan, South Sudan, Afghanistan, South Africa, please accept our sincere thanks. We still have a large number of audience with us, and they also have a number of questions. So maybe I'll start with a question. The first question is to Anya. The question is, many countries are now ready to launch national vaccination campaigns, and this will bring us a step further towards ending this pandemic. To which extent do you think the fact that this pandemic has been truly global and has severely impacted some of the most developed and polluting countries in the world will help in moving towards a just transition to sustainable lifestyles to reconnect with nature and prevent the next epidemic. In other words, are we learning something as a community of nations? Anja.
Thank you for the question. Well, I don't know if there is an answer to this. It's difficult to predict what comes, but hopefully, and I think with all that we have learned during this pandemic, and which is still ongoing, although we can look forward to vaccines, but the lessons is also that it will not reach everyone to the same extent and in the same level. And I think this inequality is something that is troublesome, and that also is part of what we are facing right now, a pandemic that hits differently together with the overall issues and especially the environmental degradation and the climate change issues. So I think that we have good opportunities, and as I was mentioning in my presentation, that although there is a crisis, we are actually not in a better situation, and we could not stand better than ever before to also solve these crises that we are in the middle of. So yes, I do think, and I hope, and I'm positive that we will learn and hopefully also act upon it accordingly. Thank you.
Thank you, Anja. I think the question was very interesting and something which calls for a lot of reflection. Yes. I have been reflecting on this myself, and my view is that when we saw the speed with which nations took decisions and actions which were completely felt impossible in February, such as we have been talking about climate change for decades, and if there was a call to cut down the number of flights, we would have never reached a common agreement. But when people felt threatened, nations stopped flights like 24 hours, no flights. And so number one, decisions can be taken when people really feel that it matters to them. And number two, the world will still go on, even though we had modeled a scenario of flights being stopped, experts would have told that that's almost an impossible scenario. So I'm hoping that the world leaders will now realize that the population in the countries are really prepared to accept a lot more sacrifice than what the leaders were conventionally prepared to accept if their life, the future of their children, and the future of the planet is threatened. So I actually feel there would be better wisdom as well as better cooperation between countries. And I would be very happy to hear your reflection when I come back on this. Magnus, there is a question on non-burn technologies. Are there, everyone is talking about incineration, some version of incineration. Are there some non-burn technologies which could be appropriate in the countries where we operate, or in other countries? It could be developed or developing countries. But if you could also emphasize on the developing countries, that would be useful. Thank you.
Yes. Well, there is definitely alternatives to burning the waste. The problem is that the point of doing this is killing off the viruses. So we need something that is hazardous in some way to kill the viruses. If it's hazardous to the viruses, it's kind of hazardous to us as well. And then the open fire and the burning not burning in an open pit, but in an incinerator, is the type that is most common to us, and that is what we know best. But you can also use, there is the chemical alternative. You can use chemicals that is hazardous for the viruses, and that kills them off. You can also use, there is alternatives with radiation that you can use, but that of course is also hazardous to people, and you need to treat the facility in the right way. It's more vulnerable. You can also use biological processes and mechanical processes, but these are a little bit more difficult to control and to overview and to maintain in the right way. You need a very good education, and you need to be certain of what you're doing to use those processes. So I believe that's why you fall back on the thermal incineration for quite some time. We strive towards something more eco-friendly, but the incineration alternative is at the moment the best one for developing countries, I would say.
Thank you, Magnus. We have a question to Britta, but others may also comment on it. Do we have any evidence of COVID-19 transmission through healthcare waste coming from any of the countries? Do we have any differential statistics of people who are handling healthcare waste being impacted at a higher rate, or a cluster of those people who are handling being impacted from, not necessarily from the countries where you work, but also from anywhere? Is there some report like that? Britta, you're on mute.
Sorry for that. I haven't seen any statistics on that or evidence on the transmission of the virus through waste. The virus has a limited lifetime, but it could also be difficult to find the source. But for example, in Afghanistan in October 2008, 1 million Afghans were vaccinated against the polio, and a large amount of the waste generated was thrown in the local municipal waste, and that caused infections, injury among the waste pickers. So it's, anyway, it's not a good way to don't. You should separate the waste and the sirens, because the waste picker can get really hurt and infected of other diseases. If it's not the COVID, it can be other problems and infections of it. I don't know, Magnus, if you know anything more about any statistic on.
No, I don't have any in the numbers that way. Sorry, and I believe that as we mentioned before as well, this group in the society is not very involved in the healthcare waste and in the what do you say? Well, we don't have very good statistics on this population, I'm afraid.
Thank you. There's a question to Ida. This is specifically about Sudan. Do you have any statistics on the waste quantities being generated in Sudan during the COVID epidemic? Is the waste decreasing overall due to lockdown and other aspects, or increasing, or the proportion of the healthcare waste increasing? Do we have any statistics? So this must be a question from somebody in Sudan rather than a generic question. I saw some numbers from Afghanistan, for example, and I saw some generic projections from China. So the question was specifically about Sudan. There's a number like that.
Yeah, unfortunately, I do not have access to that data. That's one of the issues I had. That's why I used the numbers from Wuhan instead. And Sudan is a country that is not much waste generated in. I think they have a ratio of, in medical waste anyways, of 0.6 kilograms per bed, which is fairly low. And my projection is that the medical waste has increased because of the use of personal protection equipment. I hope it is increased anyway, because we have to protect the hospital staffs, of course. So I think that the medical waste, like gloves or personal protection equipment, has increased, but I do not know how much. And I think that in the rural areas, like in the villages or IDP camps, I don't think there's much difference in the waste generated. Some personal protection equipment there as well, so more plastic, more paper maybe, but not much. But I think in Khartoum, in the bigger cities, there we would see an increase also of packing materials, because people, they shop more, they buy more things to eat at home, they don't go out to eat, they order home. So I think it's different also in what areas you look at, but I do not have specific data on how much the waste has changed in Sudan right now, unfortunately.
Very good, thank you. There's a very specific technical question being asked. This is, what should patients who are quarantined do about the waste they generate? So this is, in case people are not in hospital, if you are at home, should you, what should you do with this? If you have any suggestions or good examples from anywhere, not necessarily from the countries where you operate, but from other places, I think that would be interesting.
So who was that question, Dr. Sorry.
Well, I can start at least. The recommendation from WHO is that this kind of waste, like tissues and paper material and such, that is produced in the homes, in the caretaking of sick people, it should be placed in double rubber bags, which are neatly tied together, sturdy material, and then sent off through the waste management system. But it kind of depends on where the waste ends up. If it ends up in the landfill, those bags will be opened anyway in order to waste pickers to look for valuable materials. So the best thing would be, in order to have the healthcare waste produced both in healthcare facilities and in homes, separately collected and destructed during controlled measures.
Thank you, Magnus. I think double bagging is the preferred solution. Is there any other suggestion or examples anybody has? If you have, you can raise your hands. Otherwise, there is a question about the impact COVID crisis had on the plastic waste. Across the world, there is an increase in online shopping, including of food, and the amount of packaging which is happening. So that is increasing on one side. On the other side, the effort to ban single-use plastic was gaining some momentum, and many countries were having legislation and targets. And this came at the worst possible time. So I wanted to ask, any of you had an example on where things on plastic waste management, the regulations were, restricted or lifted or not enforced, and the quantities were increased. Maybe I'll start with you, Anya, but others can contribute if they did come across this in any of the countries.
I don't have any statistics. Again, this is something that is making it a bit difficult, as the lack of data is still there. Hopefully that is something also that what the research will provide us with, better know what the statistics says. Yeah, I don't have an example actually, but it is clear that there is possible to paint different scenarios, and there is also a difference between the developed and developing world. yes, in the developed world, we have a huge increase in plastic, and as also we have started to do all our shopping online, and transport system has also increased with a lot of air pollution as a consequence. But then on the other side, there is a waste management system that is quite content, and just to some extent at least has the possibility to act upon it and look at it so that it is managed accordingly. That is the difference when we look at developing countries, and if we look at the examples that we have been working with, I could only take them South Sudan. We see that the use of plastic is not increased actually, because the health system is in such a situation that there is one hospital in Juba. There are lots of smaller clinics, but all the products used within the health system has not increased. Also, the numbers for COVID patients is very, very low. There is a number of 3,000 people as statistics for South Sudan. If that is the correct number or not, I could not say. So we need so much more information. We need to work to get access to data when it comes to this, to say much more about and provide facts as well.
Thank you.
Thank you. Yes.
Annika?
We also know that during the COVID-19 situation, especially countries in lockdown as well as developing countries, they have had a change in what they eat, the amount, but also what kind of food people eat. And this also make a change to what kind of waste we do. And it's also make a change to the amount of water we use, which is a problem in some of the developed countries. And as Anja said before, we don't have the specific numbers to it. And some of these changes will not stop now, because it's also made a change in the cultures of what people are growing. And also in the developed countries, we can see a great change, because people not going out to restaurants to eat, but eating at home, meaning that a lot of the vegetables that are produced that are normally served in a restaurant is not consumed at home. So we have a lot of more food waste in some cases. And also food transported for restaurants in general has less protection than in plastic, of plastic, than what we have for food that are going to a grocery store or a market and then sold to the individuals. So I think that this change in waste is, without having exact statistics, it can be seen, and it will be seen even in the future. Thank you.
Thank you, Annika. I have one last question before I conclude. This is regarding protection of waste pickers. So did you come across in any of the countries where you work or outside any concerted effort to provide guidance or actually even protection to waste pickers during the COVID period?
No, I'm afraid not.
Okay. So that seems to be the common story. I was participating in an event here in India with the Minister of Health and a number of government agencies, and India actually have a major non-governmental organization who is active among the the waste pickers, and there has been some work by them among those, because they already had an established channel of communication to them. So this was, I would say, a good story where people were at least informed of the risks and then told what they could do in this situation. I was working in South Africa on a COVID-linked needs assessment, and there the situation was not very good, because in South Africa, like in many other countries, rag pickers were mostly women and children, and they were often migrants. So even when the government had systems to provide financial assistance to those who lost jobs, they were not in those lists, and they did not have many other social protection provisions which were available to people in other professions. So they were truly affected by it. So clearly, this is one of the lessons we learned. In I think you did make this case in the beginning, that there are millions of people who are in the waste recycling business, and some of these people are, in some countries, these are the only effective waste management systems out there. And to recognize their contribution, provide them with support, provide them with guidance, and provide them with health and safety advice is probably the most appropriate thing to do. I had a question directed to me regarding the amount of amount of mask being recycled. I recall once I went to China, they had a campaign regarding chopsticks, which they use for eating food. And apparently 500 billion chopsticks are produced per year in China. I'm recalling from my memory. And the name of the campaign was "I am not disposable." I am not disposable as the name of the campaign, because they were, most of the 500 billion were actually disposable. And you can imagine the amount of bamboo or whatever it is made of, which will be needed for 500 billion chopsticks per year. So if you were to think of 7 billion people in this planet, and almost everyone is advised to use mask, the amount of mask being used per day, I would imagine it would at least cross 1 billion, possibly many billions. And if you imagine 90% of that is disposable, then you are talking about many billions of masks being produced per day, every day, and it could even overhang the COVID period. So the question is absolutely significant. I have not seen any campaign to that effect. I have not seen "I am not disposable" type of thing. I have seen custom-made masks coming up. I have seen more and more innovations coming up, but I have not seen a campaign like that. But certainly a campaign like that would be absolutely useful and welcome, provided, of course, we put some minimum conditions on hygiene and other things. Part of the reason is that probably there is not enough evidence or studies on what happens when you wear a mask and you come back home, and how much of it is left, and should it be washed, and should it be washed with soap, and all those things. And if you put that along with other clothes in a washing machine, what will happen? So there are all these questions which you don't know, and because we don't know, people then just say, okay, let's continue with this less risky option. We are coming to the end of the session, and we still have 257 people online, and this is absolutely brilliant. I have this when I noticed, I'm noticing this about 80 to 85% of those who joined are still with us, and this is absolutely good. I know it is very late in some parts where you are listening, Australia, Thailand, so thank you. I know it's too early in some countries, probably in Haiti and others, so thank you for joining us from those countries. I thank all the speakers from MSB, not only for coming and giving an interesting session, but also being available to us for the last 6 months. Thank you, Annika. Thank you, Eda. Thank you, Magnus. Thank you, Britta. Thank you, Anya. I thank a number of people on the background, Margareta, Rita, Francisco, and others. And finally, I thank all the audience, and have a good night, good evening, good afternoon, good day. Bye-bye.
Thank you. Bye.
Bye.
Bye.